Greetings. COVID-19, what's new and updated? It's been 2 weeks. Now is May 27th, 2022. There are 4 items I would like to address. The first item, as you can see from this flyer, it's the CDC's community level information. This is good news and also some bad news. The 4 counties in the state of Rhode Island were recently stated as being high in contamination, but the good news is one was medium, which was Newport. As of last week, Newport has now elevated to a high status. Now, medium means basically that you don't no longer have to wear a mask indoors. But if it's a high contamination county, then you need to wear a mask indoors and outdoors, especially if you're going to a concert, sporting event, or in an area where there's lots of people integrating. So now the holiday weekends are upon us, and Memorial Weekend is coming up. And if you're traveling to Newport for a vacation, make sure that you bring your mask with you and wear your mask. While you're eating, take your mask off, but then when you're done eating, please keep your mask back on. The second thing I would like to talk to you about is the COVID testing update. Recently, President Biden at the White House had made an announcement that you can now order your 3rd round of free COVID-19 self-test kits. Now, back earlier this year, it was only limited to 2 orders per household. Now, he has authorized it to be a 3rd round of free COVID-19 self-test kits. So if you need more, proceed and go ahead to order it. It is free. When you order it, do not be concerned whether they will be asking for you for proof of insurance or proof of U.S. citizenship or payment information or credit cards. Just fill out your name, your address, and they will mail it to you. And the website to order this is the same as it was before, and it is as follows. Like I explained, if you need help filling out that form, please contact us here at the Rhode Island Commission for the Deaf and Hard of Hearing, and I will be more than happy to help you and send that form in for you. They will send you 8 test kits, 8 rapid antigen test kits. So if you do a self-test and it turns out to be that you tested positive, you may want to know what you have to do. You will follow the guidelines that have been outlined by CDC, as has been in the past. So when you test positive, you will need to isolate yourself and stay home for the first 5 days, and make sure that the people who live in your household keep their distance from you. It is critical for the first 5 days to isolate. Afterwards, call your primary physician or your healthcare provider and notify them that you've tested positive. They may ask you to come on in for, a prescription, which can be taken orally, or they may ask you to take the MABS medication, which is an IV. This medication here will stop you from getting sicker than what you already are, okay? The third thing is that when you're done with that, the Rhode Island Department of Health is asking you to please self-report that you have tested positive. Now, before they were filling out that information, but with the self-test kits that you're doing at home, you can actually, reveal your information to them by doing that information by yourself by going to the website. And that website is portalri.gov/self-test. There's an item there that says self-testing. You will put your name in there, the date that you tested positive, and this way they will be able to keep track of all the numbers of people who have tested positive in the state of Rhode Island. Now, the state-run testing areas that you may want to know about I want to let you know they will be open this Memorial Day weekend, Friday, Saturday, and Sunday, and Monday. Now, the state-run test sites are basically designed for people who are not feeling well, who are experiencing symptoms, or if you've been instructed by your doctor to go there. Or if you have just recently arrived home from traveling outside of Rhode Island and you want to ensure whether you're tested positive or not, you can go there for your test. You may be feeling healthy and stuff like that. And if you haven't traveled, do not go there, but instead make sure you do a self-test at home. If you don't have a kit to do a self-test at home, go to your local pharmacy, such as CVS or Walgreens. They have a lot of these self-test kits that they will provide to you for free. Okay, because make sure that you remain negative in case you want to test yourself. The third thing I want to talk about is the COVID-19 vaccination update. Right now, the CDC has approved the Pfizer company to provide boosters for children who are ages 5 to 11. So children who are age 5 to 11 can now get their third shot, which is basically the booster shot. And the reason why they've started to approve this for children is because they have noticed that children do get sick, they are testing positive, and their numbers are rising, just as it is spreading among adults. So the CDC felt that it was very important for children to also get a booster as well, to ensure that the children are protected and that they do not spread the virus further. If you want to vaccinate your children and can, I encourage you to call your family physician first or check in with your school nurse. And the school nurse or the administrator basically can give you further information related to the booster. And they can advise you whether your child is ready to be getting the booster or not. However, you have to make sure that your children have received the 2 primary vaccines first. And before they can get the booster, they need to wait 5 months after the full series of the first and second vaccine. Okay, but they should not be getting that booster if it's been less than 5 months since they've gotten their full series of the first and second vaccine. For more information on this, you can go to the Rhode Island Department of Health, their website, and their website address is as follows. Or you can talk to your family doctor or your physician. Now, in case people want to know about the numbers in terms of how many people have been vaccinated, we have some good news about that. And there are some other numbers that could be better. First of all, the primary vaccine series basically means the people who have already gotten their first and second shot, whether it be Pfizer, Moderna, or Johnson & Johnson if it's just one vaccine. So the total number of people in the state of Rhode Island who have received those vaccines is 875,572, which translate to 82.9% of the Rhode Island state population. Now, those who have received the primary series of the first and second vaccine along with the booster is a total of 432,926, which is about equivalent to 41% of the Rhode Island state population. So that is good news. But some people feel that that number is low. The target is to get 70, 80% in total, because those who do get the booster will increase that number, and it will also increase their risk of getting sick and spreading the disease. Now, those who are partially vaccinated or have not gotten, a booster yet in terms of getting the third one, but are partially vaccinated with the first or second shot, their numbers are very high. It is 1,038,816, which translates to 98.3% of the Rhode Island state population. That is almost 100%. And that is good news. We are still encouraging those to continue to finish their series of getting the second shot so they can move on to get their booster. The next item I want to talk about is item number 4, which is the COVID-19 travel update. As of May 3rd, the CDC has decided to inform everyone in the public that everyone is strongly encouraged to continue wearing their mask while traveling on mass transportation, such as planes, trains, ferries, buses, and cruises, and so forth, to continue wearing your mask. Now, you may have noticed that recently, many people are not wearing their mask. And you feel that maybe it's not required. But if you recall, one federal judge in the state of Florida, back on April 18th, filed a complaint saying that it was unconstitutional for the federal government to mandate wearing masks. And because it was stated that it was unconstitutional, felt that the government couldn't force people to wear a mask. That, as a problem, created a problem for many people who were doing mass transportation. So therefore, many people were not wearing the mask. So if you've noticed that if you've been traveling recently, a lot of people are not wearing their mask. It's because of what the one judge said in the state of Florida that basically contradicted what the CDC had stated and what the federal government had stated. But the CDC feels that the federal judge in Florida is not a medical doctor and is really not a specialist in disease control, and therefore felt that he was following his gut instinct on law as opposed to science. The numbers are still increasing in the last couple of weeks because of this. So the CDC is encouraging people to please continue wearing your mask. Now, I just recently came here from Washington, D.C., and I wore my mask, but I was really surprised to see how many people were not wearing their mask at the airport and in the plane itself. And I thought to myself, wow, I've already received my vaccines and I've already received one of my boosters, a total of 3, but I still want to protect myself further by wearing a mask. Because even if you've gotten your vaccine and booster, you can still get infected with the COVID-19 again. So please continue to wear your mask when you're traveling, or where you're in a county or visiting a county in the state of Rhode Island that has a high number of COVID-19 cases. Thank you.